Now time for News Extra on KNEB, 10 before 8. Our update is brought to you by First State Bank, Scottsbluff and Gering. With our program, here's Kevin Mooney.
Thank you very much, Dennis. Good morning, everyone. We have a couple of great doctors in this morning. Dr. Rommie Hughes, a general surgeon, and Dr. Farid Thanawalla. He is an interventional radiologist, and believe me, it's easier to say than it sounds. Okay, because once you spell it out, it's not that bad. Okay, so how you guys doing?
Great, thanks. Thank you.
Good. All right, we're going to talk about something that you guys have been talking about for a long time, and that's a free vascular health screening day that's going to be held up at the hospital's education center, 9 a.m. to 1 p.m. on Saturday. Dr. Hughes, I'll let you start it out. Why did you guys decide to have this?
Well, Dr. Thanawalla and I have worked together for now 8 or 9 years, I would guess, and we do a lot of cases together, and we started, in the cases, we just started talking about raising awareness for vascular health, and actually we thought it could be a threefold thing. We would get people in, we would screen them for their vascular health, maybe teach them and give them awareness about vascular disease, let them see the types of things that we do at Regional West, which for the size of our town we think is quite sophisticated. And then the third thing it gives us a chance to show off our new educational center at Regional West.
Yeah. So all three of those things. When we're talking about vascular health, we're talking about a lot of things, right?
We are. The first thing people think about is cardiac disease and heart disease, and obviously that's very important. But that same disease process can happen in any of the vascular beds, and it's those other vascular beds that people tend to forget about, and people most of the time don't have any symptoms until they have a catastrophic event, a stroke, a ruptured aneurysm, an occlusion of the arteries in their leg where they lose blood flow down their leg, and there's some things you can do medically, exercise, lifestyle choices that can prevent those things from getting out of hand.
All right. We'll get Dr. Thanawalla in here now. You guys are simply trying to provide some awareness to folks.
Absolutely.
Am I right? Come on up to the mic.
Absolutely. Our goal is education and awareness. You know the anecdotal phrase, prevention is better than the goal to a cure. Our goal is, to make patients and our general public aware, that the risk factors associated with the disease process. For example, an aneurysm of the vessels in the leg, the popliteal artery, has a high incidence and association with aneurysms of the abdominal aorta or abnormal dilatations of your main artery. Most of our patients, although well educated and well aware, personal health awareness is, something that we are trying to educate our patients on.
Okay, and a lot of times, if you're gonna have some kind of vascular health disease, you have like a family history. That's a big thing, am I right? And other things, age is another factor, right?
Absolutely. Family history, age, diet, lifestyle. Everything is associated with an incidence, a high incidence or a low incidence of medical issues.
Yeah, like smoking, for example, Dr. Hughes.
Yeah,
right?
smoking. You figure smoking is just the worst thing you can do for your health for a lot of different disease processes. But in vascular health, anybody who smokes, no matter what their other risk factors are, they have a 4 to 8 times higher incidence of having that disease process.
Yeah, so you really, and plus if your lifestyle's not good, maybe if you're overweight or whatever, something like that.
Yeah, if we do all those, as we age and do the things we all like to do but shouldn't do, like eat cheeseburgers and drink a little bit and not exercise, that all leads to the progression of the vascular disease.
Okay, all right, very good. We'll take a break, come back, tell you exactly what these guys are going to do on Saturday and the fact that they work together so well. We'll also talk about that right after this.
Hey, Nebraska, Dave Ramsey here. When I get asked where you should keep your money, for me it's a no-brainer. Locally owned community banks like First State Bank in Scottsbluff and Gering. They offer all the bells and whistles of the big banks, but with free checking that includes free e-statements, free online banking, and no-charge First mobile banking, free ATM transactions nationwide, and no monthly maintenance fees. First State Bank, Scottsbluff and Gering. Member FDIC.
All right, we're back on News Extra. We have a couple of great doctors in today. Dr. Rommie Hughes, general surgeon over at Regional West. Dr. Farid Thanawalla, the interventional radiologist. These guys kind of work together to deal with vascular disease. They have a lot of patients, a lot more than you would think, and they do some great things up at the hospital. Now, during this, we're talking about a vascular health screening day, 9 a.m. to 1 p.m., Saturday up at the Education Center at the hospital. Dr. Hughes, I guess, first of all, the screenings will be done by an ultrasound and by station, right?
Correct. We have registered vascular technologists that work in our office, and they do these ultrasounds on a daily basis. And we're going to have various stations where you'll come to this station and they'll look at your carotid arteries to see if you have disease, which will take about a minute and a half probably. They'll look at your abdominal aorta to see if your aorta is of normal size or if it's getting larger. That will take about 2 minutes. They're going to look at your veins to see if you have venous reflux, which can lead to a lot of symptomatic disease processes. And then we're also going to check your blood pressure in your leg compared to your arm, and that should be one, and that gives us an idea if you have peripheral vascular disease or disease in the vessels in your leg. Whole screening process itself should take less than 10 minutes. Painless. Should be painless.
Should be fantastic. And you'll also have some short talks as well that people can go to, right?
Some of the providers are going to give short, just very brief talks to talk about vascular disease, talk about some risk factor modification and some lifestyle choices that you can make, some medicines that you should be on if you have vascular disease, and those are going to be held at 9 o'clock and 11 o'clock, and then the screenings are going to run around those times as well.
And if your screening shows something above the minimum criteria, then something is probably necessary, right?
This is not a complete comprehensive exam. This is just merely a screening test, and we have minimal thresholds. And if you meet those thresholds in any one of the disease in the carotid artery or the aorta, then they're going to get sent for a full test, or we're going to ask them to contact their family provider for either counseling or a full comprehensive workup.
All right. Let's get back here to Dr. Thanawalla, and I want you to talk about how you guys, people don't realize you guys are doing this type of work every day where you're helping out patients, right? Between the two of you guys?
Yeah, that is correct. We've already mentioned this a couple of times. Dr. Hughes out here is a general surgeon practicing vascular surgery, and I'm a radiologist, a vascular interventional radiologist. We complement each other. We work at the Regional West Medical Center providing tertiary care medicine in a primary care setting. These screenings, etc., that we're going to be doing on Saturday are just preliminary screenings, which is more of an education and an awareness program. At any point, if the patients at this require further investigation, we can always do it at the Regional West Medical Center with MRIs, CTs, ultrasounds, etc.
And you, as a radiologist who work with Dr. Hughes a lot of times in the surgery setting to take care of the problems, right, with amazing technology.
Absolutely. We provide what is called endovascular surgery, in which, everything is managed without, cutting the patient open. What Dr. Hughes can fix, by performing a surgical procedure, he does what when the patient needs, and it's safer for us to do it percutaneously. That means through the skin. We take care of it with imaging and in the interventional lab.
And you get a lot of times patients are there for they got the surgery, maybe an extra day, and they're out, right?
That is absolutely right. Our turnaround time for our patients being in and out of the hospital is sometimes as less as a couple of hours to the maximum we've had them stay is maybe a day or two.
Yeah. So you guys have one big suite where you do all this, and the work you guys do is just as good, if not better, than any large hospital, right?
Well, that's kind of our measuring stick, and we like to make sure that we're trying to keep up on things as well as the people in Denver or a larger center you would go to. And Dr. Thanawalla is way too humble. The things he does, most vascular disease can be treated now without any surgery with just balloons and stents and wires, and the skills that he has to do that, it amazes me every day I work with him. But the thing that we try to do is to measure our results against those of the big centers. And what a lot of people don't understand is, although raw volume, Denver would do more than we do. When it's just Dr. Thanawalla and I do all the cases here, we have as much or more experience than a lot of the surgeons in Denver because we're the only two that do it here. Yeah. And so, and we do there's some things that we have to send out, and we look at it and we talk about every case, and we say if we don't think we can safely take care of the patient, obviously we send those patients, but most things we can take care of here.
All right, very good. Dr. Rommie Hughes, Dr. Farid Thanawalla, we thank them for coming in. Don't forget the Health Screening Day, Vascular Health Screening Day, Saturday, 9 a.m. to 1 p.m. up at the Education Center at Regional West.
Your trusted voice for weather, KNEB, Scottsbluff, Gearing, 960 AM, and now on 100.3 FM.